Ribcage pain is a common complaint that can have many causes, ranging from a fractured rib to lung cancer. The pain may be sudden and sharp or dull and aching. 6 possible causes. There are many possible causes of ribcage pain. A doctor will diagnose the underlying cause by a physical examination and imaging scans. Common reasons for ribcage pain include: 1. Injury. Injury to the chest from falls, traffic collisions, and sports-related contact is the most common trusted source of ribcage pain. Types of injury include: 1. Broken ribs. 2. Bruised ribs. 3. Fractured ribs. 4. Pulled muscle. Ribcage pain that begins following injury is typically diagnosed with an X-ray to highlight bone breaks and fractures. MRIs and other scans can detect soft tissue damage. 2. Costochondritis. Costochondritis, or Tietze's syndrome, is another common cause of ribcage pain. This condition is characterized by inflammation of the cartilage in the ribcage. It usually occurs trusted source in the cartilage that joins the upper ribs to the sternum, an area called the costosternal joint. Ribcage pain due to costochondritis ranges from mild to severe. Symptoms include tenderness and pain when touching the chest area. Severe cases can lead to pain that radiates down the limbs, or pain that interferes with daily life. Some cases of costochondritis resolve without treatment, while others require medical intervention. 3. Infection. Infections, including upper respiratory infection, bronchitis, or pneumonia, can cause pain in the ribs. The pain may be caused by the infection itself, a pulled rib muscle from coughing, or by pleurisy. Pleurisy occurs when the pleura, tissue between the lungs and the ribcage, becomes inflamed. Other causes of pleurisy include autoimmune disorders and certain medications. 4. Lung cancer. Lung cancer is the second most common trusted source cancer in the United States. One of the symptoms trusted source of lung cancer is ribcage pain or chest pain that gets worse upon breathing deeply, coughing, or laughing. Other symptoms to look out for include coughing up blood or phlegm, shortness of breath, and wheezing. The outlook for lung cancer is poorer than other forms of cancer, and is the leading cause of cancer death among both men and women. People with early-stage lung cancer have a better chance of being cured, highlighting the importance of early intervention. Metastatic lung cancer, or cancer that begins in one area and spreads to the lungs, is a life-threatening condition. It will also cause pain in the ribcage or chest. 5. Fibromyalgia. This is a chronic condition that causes pain throughout the body. Fibromyalgia is estimated by the American College of Rheumatology to affect between 2–4% of people and is more common in women. Trusted source. The pain associated with fibromyalgia may be burning, throbbing, stabbing, or aching. These pains are commonly felt in the ribcage, although any part of the body can be affected. Some research trusted source suggests that non-specific chest pain, including ribcage pain, is the most common coexisting condition that leads to hospital admission in people with fibromyalgia. 6. Pulmonary embolism. A pulmonary embolism, PE, is when an artery going into the lungs becomes blocked. The blockage is often caused by trusted source, a blood clot that has traveled up from one of the legs. As well as ribcage pain, PE can cause the following symptoms. 1. Shortness of breath. 2. Rapid breathing. 3. Coughing, including coughing up blood. 4. Anxiety. 5. Lightheadedness. 6. Sweating. 7. Irregular heartbeat. PE is a serious condition that can damage the lungs and other organs due to reduced oxygen in the blood. Anyone who experiences the symptoms of PE should see a doctor. According to the American Lung Association, 10–30% of people who develop PE will die within 1 month of diagnosis. Fortunately, a quick diagnosis and treatment can prevent complications. At the end, it is requested to please subscribe our channel.